the first time in my life, and I'm 73 years old, America is aligned politically with Russia as opposed to our European colleagues. And so this is a challenging moment, but I bring hope to it because, as I would say, um, um, as our Latina friends would say, the people united can never be defeated. Um, I really do want to open it up right now to questions, Maria. Since we only have an hour, I don't want to just start reading to people. Can you hear me, Maria?
Yes, Congresswoman, thank you. I'm going to come on camera just for a quick, just a little bit, just to give you quickly. We received a number of questions from the groups, and the Congresswoman is going to try to get to all those questions to give you answers. We want to thank you for taking time out of your busy schedules to join the Congresswoman. So we are very grateful that you're here. And so what we're going to do is I will read the question and the Congresswoman will answer it, okay? And then I know that you're going to have more questions after that. And what we would ask is that you would send all of your questions to myself and to Rob Hanson, and that we're going to do our best to get you answers as soon as possible, okay? Thank you. All right, the first question is, it seems that cuts to basic needs and social services are imminent. Just last month, over 241,000 people in Milwaukee County received grocery purchasing assistance through SNAP. Can you speak to the scale of cuts you expect to see with SNAP and school meals?
Okay. Thank you for whoever asked that question. One of the things that's been more enraging to me than anything is that Republicans, in order to round up the votes among skeptical members of the GOP, those who are holding seats perhaps where Biden and or Harris won, those in very, very purple seats, who, maybe the seven or eight of them in particular that um, that sent letters in, being skeptical about cuts, for example, in SNAP and Medicaid, and the response that the leadership gave them to appease them was that you don't see the word Medicaid anywhere in the bill whatsoever. The word SNAP is nowhere to be seen. This is just a framework. Well, you know, uh, like I said, I think one of the ways that we need to engage with our people, because I think a lot of them have accused us of being the elitists and thinking that they're stupid. And I think that this is a time to use their own strategy of saying, do you think people are stupid? When you're saying that you're going to cut $330 billion out of agriculture, do you think for 1 minute that we don't think that there will be SNAP cuts? And we just voted on a resolution where they had to drag kicking and screaming the votes out of them, but it was to cut at least $1.5 billion out of the budget, um, in their farm bill. Now, um, what they will say is that we're not actually making cuts. I've heard some of their justifications already. They've accused SNAP recipients of just buying junk food and adding carbohydrates to their diet. So I think that, sort of limiting what people can buy with SNAP, uh, um, sort of uh, increasing work requirements. And all of you out there know that there's no evidence that increasing work requirements motivates or incentivizes anybody to work. People are already working if they're able to work. All it does is prevents otherwise eligible people from getting the benefit. There are plenty of people 53, 54 years old who have enough uh, uh, medical and health problems and other obligations with people that they have to care for, so that they would be discouraged from applying because of the complications of their lives. So, yeah, we already know that they do it. Of course, we got 700,000 Wisconsinites who depend on this program. So that's the sweet spot for us, because if they want to take this benefit away from 700,000 people in Wisconsin, we know these people and we need to get them active. We need to, because it does work. Bugging, uh, Brian Style, who is taking over two of my beloved communities I used to represent right here in the Milwaukee area, St. Francis and Cudahy, um, Senator Johnson, having them call and let them know how much SNAP means to them. SNAP is definitely on the menu. So I'll move on to the next question, Maria.
Okay, the next question is about the budget
Oh, no, no, let me
resolution.
let me just make one more point. It's not just SNAP. It is uh, the 23 million children who attend high poverty schools. They want to mess with food in that way too through the Ag Committee, not just SNAP. There was a community eligibility provision, so that instead of bugging individual parents and I had to go through it where the parents had to send back a certification of what their income was to see if they were being eligible for free school lunch. All that did was really deny and deprive eligible children of food. So we had the community eligibility provision. That's something that they want to cut out. That way, sort of just automatically
Hello,
not
Congresswoman from Lawyer's
providing
office.
not providing funding to schools and children that would ordinarily be eligible for it. So I just want to throw that in because I think that that is really, really critical. And from my own lived experience, it is very traumatic to be a school child and not to be hungry. It's hard to learn. Maria?
All right, I'm ready. So this is a three-part question, Congresswoman, about the
Okay.
budget resolution.
All right.
All right. So are there any issue areas that are more at risk than others? And what are current strategies to save the basic needs of our community members? And what can we do as individuals and as organizations to respond most effectively? And what do elected officials need from social service agencies to fight the fight?
Okay. How many parts of that question were
So it's
there?
actually four.
Okay, well, yeah, that's part of their strategy, the shock and awe, to break all this stuff fast, so that we can't respond quickly. And it's a great strategy. It has us running from the Department of Education to SNAP to Medicaid. They think keeps us in disarray, keeps us discombobulated. And of course, they have as much money as they need to put out their messages, and to really, kind of the underlay for the overplay, as they would say in the hood. Basically, giving you the shock and the awe of all these firings of uh, of employees who are probationary employees, and of course, as quiet as it's kept, and as dramatic as that is probably the least harmful of all the stuff that they're doing. Yes, there are other areas that are at risk. I mentioned it earlier, and I can't emphasize that they want to take $880 billion out of Medicaid. And of course, that has an impact on everybody from the cradle to the grave. Births, 40% of births in this country are on Medicaid. Um, healthy, the Children's Health Insurance Program, of course, is Medicaid funded. The parts, there are dual eligible people. So there are people, for example, who go to dialysis every day, people of all incomes, since nobody really can afford the cost of dialysis. But Medicaid, for example, pays for services like rides to the dialysis center, pays for, and I guess you all know this, it pays for rides to medical appointments. And that's the kind of stuff that really is at risk. Because when you think about the biggest expenditure of Medicaid on nursing homes are going to have priority in terms of payment that than these other services which are regarded as optional. So, I know we have one agency. I'm thinking Independence First. Maybe I got it wrong, but there's one agency on here that's RSVP, and I know that they provide like 26,000 meals a day, and Medicaid sort of helps them with that. So um, we are really at risk with Medicaid, and that's the one where we had a lot of Republican legislators are worried about this one. Steve Bannon, of course, uh, warned Donald Trump that there were a whole lot of MAGA that needed Medicaid, and of course, Donald Trump has lied and said he was not going to touch Medicaid, but we know he's a liar. You know, he has said that he didn't know anything about Project 2025, so we can't take his word for it. And all you have to do is look at the numbers. If they're going to take $880 billion out of the energy and commerce uh, footprint, $880 billion just by itself is already more than the federal share of Medicaid. And here are the ways, but here's the lies that they're telling people. First of all, the one that makes me want to laugh is from one of the good friends of mine, Don Bacon, somebody that I have some respect for. But I heard him on on TV on the National Journal saying that even though there may be cuts, the quality won't be affected. That's the one that either brings tears or laughter from you immediately, hysteria, I would think. Because I can't see how we're already having problems with nursing home staffing, how if you cut Medicaid, that won't be impacted. And so people's loved ones will be laying in their waste for 5 or 6 hours at a time in a nursing home. Ways that they're talking about doing it, of course, block granting it, worst possible scenario. Other ways is requiring work requirements, which people already work, but this again would be an effort um, uh, to discourage enrollment. Another way is that they want to cut the abilities of states to get provider taxes, healthcare provider taxes from Medicaid providers and for all providers to help with the state drawdown of federal funds for Medicaid to help them meet the match. And so by forbidding states to collect this tax from providers, it cripples the state's ability to get enough money to draw down. How cynical. We're going to keep you from taxing your providers so you won't have the ability to draw down more money from us. So that's another suggestion that's in the queue. And of course, they can sort of wipe their hands and take their fingerprints off of it just by saying, well, Wisconsin didn't have their maintenance of effort in order to be able to draw down enough money. And if they're suffering, it's because they couldn't meet their match. Another thing that they're thinking about doing in the healthcare realm uh, is is and this is not necessarily Medicaid, but it has an impact on it, is disallowing hospitals their nonprofit status, taking it away. I'm sure Mayo Clinic would be just fine. I'm sure Cleveland Clinic would be just fine. But I'm telling you, those rural hospitals, our hospitals, St. Joseph's, Mount Sinai in this area, they would be decimated by that kind of trick. So these are things that yeah, are live too. So we already talked about SNAP, Medicaid, education is very much at risk. Not only they're talking about destroying the Department of Education, but of course the Department of Education is not just. I mean, it's everything from Head Start funds to Pell grants to enforcing civil rights of students. Um, they do claim that they will not be backing away from obligations to disabled children, but guess what? They never have stepped up to meet the needs of disabled children in the first place. So you can take that with a grain of salt. Also, all also under the Ways and Means jurisdiction, tax committee, here's a place where they have talked about raising the national debt. So there's 4.5, trillion dollars in there. It was hard to say for tax cuts. And also they would take a lot of money out of the Inflation Reduction Act energy efficiency budget. There have been a lot of investments made in a lot of red states. And so we saw Republicans behind the scenes and during the hearings on this plead with them to use a scalpel instead of a sword on the IRA investments, because in fact, IRA investments so far have been deployed in a way that have helped red counties more than they have blue counties. So yeah, uh, they veterans benefits are also on the chopping block. We have seen them trying to privatize the Veterans Hospital for a really long time. And here would be a time and an opportunity for them to do that. We already saw the other day 10 VA workers lose their jobs. Uh, and uh, and of course, three of them were veterans. So I guess those veterans were named waste, fraud, and abuse. Those were the three. That's their nicknames for me. That that they were going to do it. The federal government is the single largest employer in this country. And, over 640,000 veterans work for the federal government as of March 2024. So these people that say they care so much about veterans, um, they have sent instructions to raise the military. But that was one of the things that I was shocked about when I first got to Congress, that the defense budget that they want to increase is different from the veterans budget. So there's a big difference. Once they've used you up, you kind of like on your own after that. Um, I could go on, but even though there have been, we have stopped some of the freezing of operations so far. Still, people who are still frozen have been food service workers, housekeeping aides, environmental health workers, who have been responsible for uh, pest control, laundry services at the Veterans Hospital, ensuring that the rooms are clean and that the surgical suites are clean. The National Cemetery Administration employees um, are being cleaned out. And so, yeah. And of course, everybody is vulnerable when they say that they want culturally specific programs gone. And so I guess we can get into that. I think there might be a question on that in the queue. Am I right about that, Maria?
Yes, yes, Congresswoman. So this is from an agency that provides culturally specific services in domestic abuse and sexual violence intervention programs. And the question is, what would you say that these programs can do to make their work more palatable to the new administration and deserving of support.
Wow. This is why we have got to win, y'all. We've got to. I mean, I'll tell you. Um, this is from an agency who's culturally specific. I have, one of the things that started out being a horrible thing for me, but really turned into a laughable moment was when I went up to Fort McCoy to greet some of the Afghan refugees that had been flown in after we, ended the war in Afghanistan and people had to flee for their lives. And I got up there to Fort McCoy, and uh, the people were very, very upset because they had been served something that I would have enjoyed, some like shrimp gumbo with sausage in it and andouille sausage, and it sounds good to me. But of course, that that was not halal or kosher. It's shrimp in it and pork. Um, and you don't know what you don't know. And actually, I know the husband of one of the people who got that contract. I bet you that was some good gumbo, but it's not good gumbo. If you're a Muslim, you don't eat that. And so it's we have culturally competent domestic violence programs. The domestic violence, as you all know, is one of the major tools of war. It is that there are 3 women a day that are killed in domestic violence situations. That every race, creed, color, there's no exemptions from this at all, and we can't say this just happens to Republicans or just to Democrats or doesn't happen in the Hispanic community. We need cultural comp. We need people who can speak the language. If you're traumatized and you need a safe respite and we don't speak Hmong, where are you going to go? I mean, if you're an African American and you just have some, you need a culturally competent and specific place to go. So we're going to have to win. And a matter of fact, um, uh, with regard to challenges to that, um, I think part of that is that it's hard to disaggregate. Everybody has been to some DEI training in public service. And so this is going to have to be one of the areas of pursuit, I think, particularly among our unionized workers. I mean, everybody is in trouble. Everybody's been to a DEI training. And what makes you DEI? I mean, if you teach in Spanish, is that going to be considered DEI training because the president has just declared that English is our, you know, is our official language? Is that going to be a DEI violation? It's going to be hard to unwind. We've already seen programs in Wisconsin being scholarship programs that target helping minority students being challenged. Um, we see directives within the Department of Public Instruction on the state level. I have heard anecdotally that people are being asked to turn in people that they're outside groups that are trying to find out if there are teachers that are teaching critical race theory or DEI in our classrooms. And so we do need teacher protection from our teachers union. I mean, what happens if you had a, a Black History Month bulletin board up? Is that violating DEI instructions? And so this is one of the things that we're going to have to navigate. Now, on February 25th, which seems like a long time ago, a judge put a stay on the DEI executive order. And they said that grant recipients should still proceed with extreme caution. So our recommendation is y'all stay as close to possible to the statutory language of the grant. Um, tell the stories of the victims of survivors, uh, and so on. Like, for example, I don't know, if, if you were to say, you gave service to people who didn't speak English, and so, would that violate it? But stick as close to your program guidelines as possible. Uh, uh, and think outside the box, so that you can and not rely on describing their race as the reason that they needed support and help. Maybe describe their circumstances. So a woman was beaten almost half to death with 3 children, for example. Is that a good answer?
That's a yes, yes. The next question, Congresswoman, is what areas do you see the most bipartisan support? For example, programs, service areas, or funding streams?
Well, I have been very happy and very blessed to be able to work on a bipartisan basis with members, which is why I am holding out a great deal of hope, because I know that there are numbers of very decent Republicans there. But of course, they're terrified of Donald Trump. And it's hard to predict what they will or will not do. Like, boy, if someone had me betting any money that Joni Ernst wouldn't have voted for Pete Hegseth for Secretary of Defense, they could have suckered me out of a lot of money. If because I would have been able to swear that she wouldn't have voted for him. But I don't want to judge her. They told her they would kill her. And I don't think they were joking. She was getting death threats that they would kill her, knowing that they needed her one vote to get it over the line. So, but I've worked with the TRIO Caucus, the Foster Youth Caucus, the Great Lakes Task Force, the Prevention and Wellness Caucus, uh, you know, and you know, I, we worked on foster care, and it's been great. But USAID was something that was always sort of a bipartisan initiative. I've taken so many trips with Republicans where we have seen where we're saving people's lives. And right now, I'm sure the body count is going up every day with the loss of funding for PEPFAR, for the AIDS initiative that President George W. Bush put together with our recently former colleague, Barbara Lee. That was my Marco Rubio moment. And so they're terrified, which is one of the reasons that the community strategy of y'all bugging these people and bugging them and bugging them and bugging them becomes so important. They are terrified of these Medicaid cuts. This seems to be a place where we can get it. And like I said, just to hear them mumble out defenses, they think that all they're doing is getting just the lazy ne'er-do-wells off their behinds. So to tell stories of the people who could live at home, to make videos of the people who could live at home, but for the fact that they won't be able, because one of the first things going to be cut is Medicaid's home health services. They're not going to be able to prioritize that over nursing home care. So we need to connect with our constituencies and let them know, you know, that the ability for, for the elders to stay at home longer is probably one of the first things on the chopping block. And I think that that's an area of sensitivity where we can get in there and dig in there. Another thing that somebody and an educator stressed to me, and I don't know whether this is true or not, maybe I can get some feedback from you all, is that the Pell Grant. The Pell Grants are something that 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 go further than just need based of the lowest income. There are a lot of so-called middle class kids who would be eligible for Pell Grants, and that may be another way to get to them, even for technical colleges, that might be a way uh, to to get them. I think um, I think
Congresswoman, the next question is regarding community funding projects. What is your
oh
sense on community funding projects going forward, FY 26? Will there be appetite in Congress or will this likely be cut?
well, honestly, I have my own opinion. I think that once they just let all the animals out of the cage, that they're not going to want to not have something to bring home to their constituents. I think they're going to want to allow community projects, but I do think that they will sort through ours to make sure it's not DEI. I think it'll be a two-tiered process, and I think I think that they would certainly put restrictions on anything that involved DEI. Like I had a community project to put on to work toward working on Black History Month programming. That would probably be a target. Um, um, but for example, I'm thinking of like the Latina Resource Center, which they fight domestic violence. Again, I think to be able to say domestic violence is occurring in this area, in this zip code, at a high rate, and therefore we need funds to do it. I think that there are ways to work around it so that we are not lifting up the DEI provisions. I think that we ought to make sure that we have some workshops as I talk to my staff and try to help people figure out how to use keywords and sort of get around uh, strictures as they come forward with them when they come forward, when we get to that part, if we get to that part. But I don't think that they will cut them out. The Senate, I think, may have a more standard earmarks process. But of course, that's not even the issue at this moment. I mean, we're not even close to the point in time that we're talking about earmarks. I mean, we're trying to get past March 14th and keeping the government from being shut down. And that's I think we gotta keep the main thing for right now, Maria. 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 Uh-oh.
Okay, I was muted. I'm sorry.
Okay, I'm sorry.
Okay. The other question or another question is regarding the presidential executive order limits. What source to use to know and stay up to date on executive orders, their status, whether immediate implementation or judicial response, etc. So
Is there any way, Chad, is there any way to put this stuff in the chat, like litigation tracker, um, executive order trackers, uh,
We
uh,
could probably send it out after.
okay, you know
I
what, Maria?
I think that we can share these links with the group
Yeah,
with the entire list that we have for our community-based organizations. We can share these links
right,
at the today later when we're done with the event. We're happy to do that.
right. Because I don't want to make the mistake of starting just reading and cutting out our time.
Okay.
Um, you know, so but I do think that uh it's really important. And the thing is that if you honestly, if you know of a case that is similar to some of the cases that they're trying to bring, of where there's a real hardship and you may have a plaintiff, you need to contact those groups or those unions and let them know. Say, I got the perfect litigant from you. I remember, well, no, I don't remember because I was a kid, but back in the day, when Martin Luther King Jr. and Coretta Scott King, when they did the Montgomery bus boycott, the first woman who wouldn't get up to get out of her seat, I think her name was Colette something, but she was unmarried and she was pregnant. And so they didn't see her as the NAACP thought that it would be too much attention for her to be a plaintiff. She was just, a defiant Black woman with that, might be seen as kind of loose morals. And so that's when they staged Coretta Scott King to become the plaintiff. So as to that, and so the thing of it is, if there are plaintiffs, people have already been harmed or injured, because we've seen people, like there was one person who, in Virginia, I'll just come up with a random example. There was somebody who was an entrepreneur, say they were paying taxes or hiring 3 or 4 people, but they had the benefit of having the expanded Obamacare. Oh, so that's another way they're planning on cutting Medicaid, is those states that took the expansion, unlike Wisconsin, where the federal government was paying 90% on the dime, for the maintenance of effort. They may get, they'll just easily say, oh, well, the state just couldn't meet their maintenance of effort. It wasn't our fault. So instead of having the 90-10, they would go back to maybe even 50-50, depending on how they structure it. Actually in the Ways and Means Committee, but they could go down even as low as 50-50. I think our match in Wisconsin is 60-40. But there might be people who were employing people, but they immediately lost their health care. If we know somebody who got sick because they didn't have anything, I think that if you guys have injured people from these cuts, it's important to stay. This network needs to know about that.
All right, Congresswoman, the next question is regarding the Medicaid program and the impact on people with developmental disabilities who want to and do live at home rather than nursing homes or institutions, but home and community supports are an optional Medicaid service, while facilities are mandatory. So the question is, how can you work with the disability and other Medicaid communities to fight these proposed cuts?
Excellent question. I mean, and so one of the things that you guys have got, are the receipts in terms of how much more it would cost for institutional care than for people to stay at home. And, and sort of, get us this information of how it will affect these people. I know Wisconsin once upon a time had the greatest disparity in people who could in out of home placements where people could have stayed at home than anywhere in the country. And I do think that it's really important, for all of us to work together to stop this, and to bring it up as testimony and as an issue as we start putting these things together. All of this, like right now, within the next 2 weeks, I would love to have some assessment from you all in my office about the numbers of people that this has an impact. Maybe I already have a paper on it, but so I know we got organizations that are on this call who have this information and the impact that it'll have, and I would love to lift that up.
All right, Congresswoman, this question is from People First Wisconsin, and
Okay.
they're asking about their grant. So they are under the understanding that funding for their program or for their agency is not assured past March 14th, which means that over a third of their funding is not assured either or either. They support multiple small community-based organizations statewide. Therefore, a threat to their funding is a threat to many small groups, helping people with disabilities stay safe and healthy. They say that they know that you have long supported the critical work of their agency and that it's an important voice in advocacy, program integrity, and program quality controls for people with disabilities. And they want to know what you're doing to protect the state councils on developmental disabilities.
Boy, I tell you, um, I guess uh, one of the things that we have got to do is to challenge them on their promise. I think it'd be really important for us to lead a letter lifting up President Trump's promise not to have an impact on the disabilities communities with his decision making. And we ought to, with the help of people first, uh, get a letter out just lifting up uh, the plight of these boards and send this letter to the um, which this is the education into the workforce, right? Or is this Health and Human Services grant? Okay, somebody needs to unmute.
Is someone from Wisconsin, from People First Wisconsin on that can answer that?
Um,
Yeah.
Hi, this is Nancy from People First. I was actually, we get our grant actually from the Wisconsin Board for People with Developmental Disabilities. So
Yeah.
each of the states has their, is designated to have a DD council. So ours is the BPDD. And so that's where our grant is actually coming from.
It's coming from the state.
It's coming from the state, but it's coming down from the federal government. And I
Through
guess
what?
I'd have to look. I don't, unless Barbara Beckert knows, because I don't recall exactly what area it comes
Well, I
from.
mean, it would be a good
Okay.
example of just pushing it in Donald Trump's face. Since he's
Yeah.
specific, as I think, we've just, just this little brainstorming session, we've identified another area of vulnerability that they have.
Yeah, I guess we're
That
just,
they're
yeah, we're,
vulnerable on Medicaid, they're vulnerable on disabled people because their big thing are all these, theoretical able-bodied people that are going to be trying to get Medicaid and SNAP. But you guys are not dealing with that population of people, and we need them to commit to a carve out for that. So let's staff and everybody, let's work on that as something that we do and get in front of the appropriators.
thank you.
All right, Nancy, we will follow up with you, okay?
Yeah.
Okay,
Thank
so
you
there's
so
a
much.
question that we're not going to be able to, the Congresswoman's not going to be able to answer. But we have our staff in DC, our legislative director, Chris Goldson, is working on obtaining an update for you. This question is regarding the nonprofit security grant program. And the question is whether if we know if the whether we know if the FYI 25 grant will likely be released as scheduled, as the funds have already been appropriated. So we are working on a response for you, and we'll get that to you as soon as we get a reply from the Department of Homeland Security. So we're going to move on to the next question. So what is Congress doing to restore the funding freeze to the refugee resettlement program? A established contract with the federal government, specifically the Department of State, to provide one-time funds to resettle refugees who arrive in the U.S. via legal vetted means. This has caused refugee resettlement agencies to be triply impacted. First, by the end of the refugee arrivals. Second, by the resettlement work stoppage and funding freeze for those who are already in the United States and being served by our agencies. And third, by the federal funding freeze for nonprofit organizations.
This is
That
a
was a
hard question.
mouthful.
Yeah,
Yes.
it is. Well, I'll just say this. you know, everything they're doing is illegal and unconstitutional. And I think that they have given you, all of us, the impression that they have an absolute right to impound funds. They do not have a right to impound funds that have already been appropriated. And there is litigation, not necessarily specifically with this funding, around that whole issue of their, and this has gone to the Supreme Court in the past, unless this Supreme Court is willing to overturn what has already been done, that the impoundment of funds is not legal. That Article 1 of the Constitution, which our members of Congress are allowed to do it. Now, there's discretion, because I was trying to listen to a podcast about this. There's some discretion, like if the legislature says that the president can spend up to $1 million of it, and he decides, well, I don't want to spend up to $1 million. I only want to spend $500,000 on it. That's some discretion built into it. But certainly the ability to just not pay, which is one of the reasons we have a lawsuit that's already pending, not on this specifically, but it's the contractors from USAID. That's what the Supreme Court just put on hold. Was it last night? They extended the deadline until when? Monday, for them to pay that contract. So, we, part of that answer is going to come from the result of that litigation. There's uh, uh, there's there's a new Trump tore down the refugee resettlement program during his first term, driving resettlements to historic lows, and now he shuttered the program altogether. And the repeal of the sensitive locations policy, holding migrants at Guantanamo, and the new announcement that will require many non-citizens to register with the federal government, and those who would not even be subject to criminal prosecution. So this operationalizes the non-citizen registration requirement embodied um, in 8 USC 1302. It's a World War II era provision of immigration law. And it's going to subject some non-citizens to possible criminal prosecution under a set of related criminal statutes if they fail to register. And so this also leaves unregistered immigrants between a rock and a hard place. And so their House budget resolution and the Senate resolution as well includes billions of more dollars to target families and asylum seekers, and giving the Trump administration at least $100,000, 100,000 more beds that they're seeking. Um, uh, you know, uh, they're, we have got to convince Republicans to claw back our Article 1 authority. That's a larger immigration policy, but with regard to stuff that's already been granted, I'm hoping that Monday we prevail in court. But I couldn't resist bringing up the other threat, that and they've got their narrative is that the public is really supporting Donald Trump with his immigration policies, is focusing on real threats and targeting the drug cartels and human traffickers. But we have found that very innocent people are conflated in that. And so um, the other thing that we can really bring up to them is the real cost of trying to deport every single person who may be undocumented. Uh, we just and the economic loss of $5 trillion over a decade. I used to say 1 trillion, but that has been upped given the productivity that immigrants have had in our workforce and the mass deportation. We could have economic losses, farmers, corporations, companies of $5 trillion over a decade. And so this is one of the things that we have at stake. I know that's not a great answer, but it's we got to wait and see what happens with some of the court cases we have regarding impoundment. And number two, uh, when will our colleagues sort of claw back the Article One power?
All
Maria?
right, Congresswoman, that was the last question. I wanted to just quickly let everybody know, thank you again for joining the Congresswoman. We would love it if you could stay in contact with us to share your concerns, or if you have any needs. Rob Hanson added our emails on the chat. Please do reach out to us. We would also like to add you to our listserv to share news, updates, and if it becomes too much for you, all you got to do is just let us know to take you off the list, and we're happy to do that. But thank you. I also wanted to mention the Congresswoman will be hosting some congressional cafes in the next few weeks, and once we have that all in place, we will share that information with you so that you can share with your clients. Okay?
Let
Thank
me
you
just
again.
thank everybody, and let's give one more opportunity before we close out for the question that didn't make it into the one or two questions, or the just compelling question that we need to ask about anything. There's a lot of I have a lot of information here, and I didn't want to overwhelm you, and I also didn't want to insult your intelligence by reading stuff that you already know. But is there a question that someone would like to give that we didn't touch upon? Because I'm sure we missed something that may be very important. Now, we didn't talk about international affairs at all. I know for sure, and Ukraine.
Congressman,
We
Congressman
we didn't talk about
Gwen.
Gaza. Pardon?
Yes, I have a question. I'm looking, this is Laura from the United Community Center. Thank you for this. One of the questions that I'm looking for answers on are specifically on the title funds for Title I funds and SF funds for our ESL students that we have an influx of, especially in the inner city of Milwaukee. Wondering if you know anything about that, or if that is in limbo, along with, have you heard anything in regards to the Head Start and what they're doing with the grant with that MPS lost?
Yeah, I just talked about the grants that MPS lost just a couple of days with people, and what was going to happen to that. Those have uh, those have already that money has already been appropriated, right? We're not talking about new funding. The MPS contracts.
Yeah, I don't know if it has or if it has not. We have not heard.
Heard.
Yeah, so that's why I was just wondering anything about new grants that may be appropriated, or how can we support and advocate for that continuation?
Right.
Um,
Well, I'm just have to tell you the truth. We're uh, just to adopt some of the excuses of Republicans that they haven't gotten to the part where they have marked up the actual budget, the actual appropriations bills. You can't say specifically what, but this is the I have always headed up or been a part of a Head Start bill letter, and there will be letters sent around among all of our colleagues with regard to Head Start programs. Now, the good news is that Head Start has traditionally been a bipartisan program. It would never have survived these decades had it not been a bipartisan program. What we don't know is whether or not Elon Musk is going to consider that waste, fraud, and abuse. That is what we don't know. Um, but the Head Start has tremendous results. You guys got the receipts. So it's not a matter of whether you're qualified for them or not. And I can promise you that there will be a Head Start letter. And that's that's that we always fight for Head Start. Even when we had Biden and Obama in there, we had to fight for Head Start funding.
Thank you.
All right, I think Congresswoman, we want to make sure you get to your next meeting on time. Any
Okay.
other questions that are in the chat, we'll work to address them as soon as possible.
Thank you, everybody.
Thank you for your time.